Hi, friends. It is Saturday, April 11th, and that means that this is my last night in the hospital. Hopefully. I actually published a piece in residency entitled My Last Night in the Hospital about my last night of residency, which going into primary care I thought was my last night ever. And that piece, of course, turns out to have been a horrible jinx. So I will not be saying with any certainty that this is my last night in the hospital. Although I certainly have every intention of making it the last time I'm ever working overnight ever again. Last night was harder. Our emergency department remains relatively decompressed, but what that means is we have quite appropriately been bringing in patients from our satellite hospitals. This makes sense as has been well established in New York City and I'm sure in other areas. Lower income neighborhoods have been hit much harder by coronavirus for very obvious reasons. Number one is health disparities. It is well established that people who have lower incomes, as well as people who identify with non-white races, have higher rates of the comorbidities that place you at risk for coronavirus, obesity, COPD, diabetes, etc., which is a structural problem in the United States that needs to be solved. Secondly, is the population density. People in low income neighborhoods tend to live more to an apartment, especially in New York City. And so the physical distancing that we're recommending is less effective in those situations. If you have five people in your apartment, staying in your apartment doesn't mean you're staying 6 feet away from people. And third, people who are low income are less likely to be able to work remotely and work from home. And so many times, people in low income neighborhoods face the choice of working and continuing to bring in money to eat and pay rent versus protecting themselves from coronavirus. And so, through no fault of anyone in these neighborhoods, the rates of coronavirus is much higher. So the outer boroughs have been hit hardest by this. Washington Heights is also a hotspot, but that being said, um, we started importing people from other hospitals, and they are pretty sick. The medical admitting attending at our hospital called over to one of the emergency rooms we were admitting from, and the person there reportedly said, "It's been like Dunkirk over here. We've been fighting with no hope of rescue," which was evocative, to be sure, but reminds me of something that I hate, which is the use of military or martial metaphors in general to talk about medicine. A lot of people talk about this as a war against an invisible enemy, and not just folks on the right, but Emmanuel Macron in France, has said this, and other people. And I think the reason we use military analogies to talk about medicine so readily is that they're very accessible. We are all familiar with the idea of war, and also the fact that they're very evocative. War brings out strong emotions in us. But I think it also turns on an incredibly stupid part of our brains, and is counterproductive. And I will tell you why. War causes us to think of suspicion of enemies and of mistrust. It does not inspire international cooperation. It inspires the idea of everyone for themselves. It does inspire nationalism and a rally around the flag effect, but I don't see how that is particularly helpful or productive. That leads to things like Mexico closing an American ventilator plant because that plant won't sell to Mexican hospitals. It leads to things like Trump threatening to sanction 3M because they're selling to their masks manufactured in Asia to Asian hospitals, which they need them. And I think that is dumb. I would much prefer the language of a natural disaster. Why don't we talk about this like a tornado tore through our world? Why don't we talk about this like this is a disaster of unprecedented proportions? We need to band together in order to take care of it. That inspires the same kind of seriousness and self-sacrifice as the military analogies do, without the kind of selfish emergency thinking that makes things like Japanese internment possible. So the next time you hear a military metaphor for medicine, whether for a pandemic or just for fighting cancer, realize that that is not the most productive way to talk about these things, even if it is an effective way to communicate the seriousness of what is going on. Tonight was much more ranty than previous nights, but that's been on my mind for a little while. Um, Feeling wide awake. I'm ready to go. I'm gonna go admit some patients. Um, it's still tough, man. The incidence of new cases in New York is plateaued, it would seem. If you look over the past 7 or so days, the incidence has stayed pretty flat day to day, which is good because they're anticipating, or they were previously anticipating, like a 2 to 4 week plateau and then starting to fall off a little bit. So if we've hit that peak earlier than we expected, that's great news. But the problem is the ventilator need and the deaths are going to be delayed because it's, usually it's a while after you come into the hospital that you actually need the critical care, and then the patients on the ventilators who get better stay there for 12 days ish, and the ones who don't sometimes longer. So we are still going to have a vent shortage, and we're still going to have too many crit care beds and not enough people taking care of them. Um, but at least the incidence is down, which is good for everyone. Not down, flat. At least the incidence is flat. Okay, well, I'm going to go back to it, but I hope you are all doing well. I hope you are all maintaining some hope and some happiness and have picked out a super cool project that gets you through the day and have a warm cat on your lap and or actually get to see your dogs and your families and everything else. I'm very much looking forward to that when this whole thing is over. In the meantime, I have you all to keep me company, so thank you for those who've reached out to say hi and you appreciate the videos. I'm glad you do. I'm going to keep making them. Spread them around if you think people like them. I'm happy to be here for you. Have a good night.